Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen.
Let's talk about, now that you have a brain, well, what happens when you hurt it? So I call this part bruised brain, shattered life. Brain injuries affect 2 million Americans every year. So you have to learn about the brain because otherwise you won't understand this. Brain injuries affect mood, they affect judgment, they affect your reaction time, they affect self-awareness, coordination. Certain genes make some people more vulnerable to injuries. There's a gene called the apolipoprotein E4 gene. If you have this gene and you have a brain injury, you're at 10 times the risk for Alzheimer's disease. 25% of the population has this gene. So that means of those concussions you see Friday night at the high school football game, a quarter of them may cause serious long-term problems for those kids. So I believe you should actually screen children for the ApoE4 gene. And if they have the gene, golf is good. Tennis is terrific. Table tennis is the world's best sport. You should not let them play contact sports that put them at risk for a head injury. And when they go, Daddy, I want to snowboard. Daddy goes, no, I don't think so. And distracts him and says, well, let's go play golf. Or let's go play tennis. Or let's go run. And we don't even think about that. I mean, you have to help me with why we don't honor the brain in our society. We get excited. Super Bowl weekend's coming up. Right? And I don't know if anybody saw the hit. It was in one of the games where the safety, the receiver was going to catch the ball. And actually the ball had come right to him. And the safety put his shoulder pad into that guy's face. I mean, took it into his helmet. And you could just see his helmet go back for. What do you think's happening inside that young man's skull? His brain is slamming up. Now, if he has that gene, it can be very bad for him. And we don't think about it. Oh, they're just making a lot of money and they don't care, and that's why they do bad things. Many of these guys are brain damaged. Okay, brain injury. This is an MRI scan. You can just see how in this scan it took out the left front side of the brain. Now, as we talked about, your brain is complicated and soft. So brain injuries really matter. And we talked about this before. Phineas Gage, who had that spike go underneath his left cheekbone, behind his left eye, and out his left prefrontal cortex. And he never lost consciousness. And that's sort of the scary thing, is loss of consciousness may not dictate how serious a brain injury might be. Another reason we need to think about protection. So in one study, brain injuries reduce goal-directed behavior. Think of that as frontal lobe activity. Reduced motivation, reduced self-awareness, reduced emotional activation. They just didn't care as much. They didn't have the fire, didn't have the passion in life. Very high incidence of mood disorders associated with brain injuries. Now, a lot of people go, well, why would you ever want to get a scan? He's depressed. He meets the DSM-4 criteria for depression. Well, many people don't know that depression is commonly associated with brain trauma. And it may be you're not really dealing with a primary depression. What you're dealing primarily with is brain trauma. So it can be associated with all of these different things, from depression to mania to anxiety to post-traumatic stress disorder. If you damage your frontal lobes, you're more at risk to do things you know are wrong. I had one patient once. She was in 6 alcohol treatment programs. And then they finally sent her to me, and yes, she had a damaged brain. But when we saw her, she had this huge dent in her prefrontal cortex. Ever in an accident? Remember, you got to ask people 5 times whether or not they have had brain injuries, because they forget. You ever in it? No. Are you sure? You ever fall out of a tree, off a fence? She goes, Dr. Amen, I was 10 years old. I fell off a horse, and he kicked me in the forehead. Do you think that has anything to do with it? Maybe. Why? Because she couldn't learn. She couldn't use 6 alcohol treatment programs. That meant she wanted to be better. She went to 6 of them. But she couldn't get it because basically she had no supervisor in her head. There's something called an orbital frontal syndrome. The underside of the prefrontal cortex, right? Orbital frontal just means above the eyes. Orbital, eyes. So it's right on top of the eyes. So we usually call it the inferior orbital prefrontal cortex. Inferior meaning toward the bottom of the prefrontal cortex. Orbital above the eyes. When there is damage, they usually don't show deficits on standard psychological testing. There are usually no deficits on CT or MRI scans. Usually do not show abnormalities with EEGs, brainwave studies. But what they do show is marked personality change. And what often happens is they have an injury there, the neurologist orders an MRI, psychological testing, everything's fine, and what do then is they say that you are faking. So they traumatize you yet again. You're traumatized from the lack of function, the loss of function. You're now traumatized by being called a liar. So, personality change, mental inertia, loss of initiative, and loss of social skills. You don't think before you say things. Will that get you into trouble? You bet. Being married is like one of the hardest things you'll ever do. And if you don't have frontal lobes, you just say the first thing that comes into your mind, and it's not good sometimes. So it also causes, reduced executive function overall. It reduces your ability to stay employed, to be reliable, to be consistent and predictable, to be a good mother. Requires function in that part of your brain. So a lot of people ask me, is there literature, enough scientific literature to use imaging, like SPECT or PET, on brain injury? Well, if you go to our website, brainplace.com, and look under brain injury, you'll see 88 studies. There's a huge body of literature. And in your handout, I think I put some of them. It's actually an indication from the Society of Nuclear Medicine. So in looking at what a healthy brain looks like, I want to show you some examples from our normal group. And basically what we see is full, even, symmetrical activity. The image on the top left is looking underneath the brain. The image at the top right is looking at the right side. Bottom left is the left side. Bottom right is looking down from the top. And basically we see full, even, symmetrical activity. And remember, when you're looking at these pictures, we're looking for 3 things. Areas of your brain that work well, areas of the brain that are underactive, and areas of the brain that are overactive. And that's it. Okay? So this lets us show the underactive areas. And this view, we see the hot spots in the brain. And here gold, or sometimes you'll see it as blue, is average activity. And white, or sometimes you'll see it as red, is the hottest 15% of brain activity. And a healthy brain by and large, it's in the back part of the brain, in the cerebellum that has half the brain's neurons. Okay? So that's an example of normal. This is another example of normal. Now, in this example, you actually see the anterior parts of the temporal lobes look a little bit underactive. Well, this is a 70-year-old woman. And normally, your brain becomes a little bit less active as you age. Look inside, mostly hot in the back part of the brain. This is a police officer. Beautiful brain. Which means he's not likely to make the news for beating somebody. He's not likely to be one of those guys where somebody's taking a picture, a video of him doing bad things. Why? Because he's got good brain function. And he doesn't have hotspots in the wrong sort of parts of the brain. So this is someone who had a stroke. I mean, think of stroke as brain damage or brain trauma. And actually, if you look at this, what you realize, this person stroked out half of their hemisphere. So they are missing the left side of their brain. In fact, you can actually see very nicely, like if you cut the brain in half and looked on the inside, on the bottom left view, you can see the inside of the brain. Isn't that wild? Baby had a stroke at birth. Baby had a stroke at birth. And if you're going to have a stroke, birth is the best time because the other part, the right hemisphere, will take over language functions and will take over some of the functions of the left hemisphere. So hemisphere specialization is not, sort of solidified early on. It gets solidified later in life. Okay. Now, you want to look at brain systems that may be associated with trauma. And the first one to think about would be the prefrontal cortex, the supervisor, the one part of your brain that watches you, that's involved with things like forethought and judgment, impulse control, organization, planning, learning from your mistakes, and so on. So if there are problems in that part of your brain, this is a 15-year-old boy who was, when he was 3 years old, fell down a flight of stairs, unconscious for a half an hour, what people would call mild traumatic brain injury. Nothing mild about this. He was in 3 residential treatment programs, and they kept kicking him out because he was violent. And what you see is executive dysfunction, short attention span, distractibility, restlessness, impulse control problems. They seek conflict. They have no judgment. Now, if you're going to fall down a stairs, fall on your right side. Because if you damage your left side, you're more likely to be aggressive. You're more likely to kill somebody. You're more likely to kill yourself. Because violence tends, as we will see later, to be a dominant hemisphere problem. This is a 17-year-old girl. And this girl, when she was 18 months old, her parents were building a house in Alaska. And she was in the house while it was under construction. And the doors were in the house, but they weren't hung. They were leaned against the wall. And she took one of the holes in the door handle, grabbed it, and pulled it onto herself, 18 months old. And that, 50-pound door or whatever it was, slammed her down, took her down, and broke her skull. She never lost consciousness. Screamed. She screamed. Do you think that injury changed her whole life? It basically completely wiped out her frontal lobes. If you look at this scan, from whatever view you want, she has no prefrontal cortex. Now, it's not low in activity. She has no activity there. So why did they bring her from Anchorage, Alaska to CS? She had no judgment. She had no judgment. She's a beautiful girl. Some guy said, hey, come with me. She just went. Have sex with me. She would. She would be out in winter, and it's cold in Alaska, for like 3 hours feeding the birds, and would get frostbite. So no judgment. Now, unfortunately, there's nothing I'm going to do that's going to change her prefrontal cortex because she killed it. And even though there's neurogenesis, once you kill an area, it ain't coming back. Like if you have a stroke, it ain't coming back. How the scan was helpful is we could tell her parents, this girl will never supervise herself properly. You will always have to provide supervision for her. You can't leave the family business to her. You cannot leave the family fortune to her. She needs a guardian. Now, is that important clinical information? You bet it is. This is a person who slid headfirst into a pole and just 10-minute loss of consciousness. I mean, what we think of as minor. If you look at the image on the left, down at the bottom, I mean, she's like wiped out her frontal lobes. Now, these are low in activity. A lot more I can do with this to try to balance activity in that part of the brain. This is a bicycle accident. Flew over the handlebars of a bike. Really just wiped out the prefrontal cortex. Which makes him more at risk for aggression, more at risk for depression, more at risk for learning problems, emotional problems, and so on. Now, if you're doing psychotherapy with this guy, and you don't know this is going on, do you think your psychotherapy will be effective? I can tell you what you're going to do. You are going to say he has antisocial personality disorder. Or you'll say he has mixed personality disorder. Or you'll say he's narcissistic. Or he's resistant to treatment. You bet he's resistant to treatment because you're doing software programming on somebody who doesn't have the hardware to take it. So I want you thinking about this because if you can get a good evaluation. See, our biggest referral source is therapists. Why? Because they find the therapy goes better when your brain works better. Because you can learn. You can sort of take on the information. A common finding we see is the prefrontal cortex gets flat in a head injury. And so if you see the flattening across the top, that's very common what we see. Another example of trauma, I mean, I would go on and on. I mean, we have thousands of examples of brain trauma. It's probably the most common unexpected finding that we have. Cingulate gyrus, how does that get hurt in brain trauma? Well, the cingulate gyrus, as you remember, runs right down the middle of your frontal lobes. It runs right on top of the corpus callosum. And the cingulate gyrus, if you get hit from the side, well, it rubs against each other. In fact, there's a covering of the brain, you may have heard, it's called the dura, sort of a thick, fibrous sheet. Well, it goes down in between the hemispheres, and it ends right at the level of the cingulate gyrus. And you get hit, that sort of thick sheet will rub against the cingulate gyrus and flame it. And it becomes what we call an off-center cingulate, which I'll show you in just a minute. And what are the functions of the cingulate gyrus? Remember, gear shifter. Go from thought to thought, move from idea to idea, be flexible, go with the flow. When it works too hard, people get stuck. Now, when it doesn't work hard enough, they don't care. So when it works right, you care, but not that much. When it works too hard, you care and you can't stop caring. When it doesn't work hard enough, you don't care at all. So low activity in the cingulate gyrus, amotivation. High activity, you can't stop thinking about it. Okay? So excessive activity, worry, hold grudges, stuck on thoughts, behaviors, more likely to have addiction, and more likely to be argumentative and oppositional. The Discovery Channel and I did a show on my imaging work. And Willie was an A student and drove a cab for his way of earning money during college. Well, he got into 2 relatively minor accidents. But on the last one, his head really hit the windshield hard. No loss of consciousness on either one. but he noticed a significant change in his behavior. His appetite went way up. His irritability went way up. He couldn't stop thinking, and as his appetite went way up, he gained 70 pounds. And his roommate said, "Stop eating my food." I don't know if any of you have roommates in college. I had two who I adored. But, that was like an issue. Who's eating my food? Right? Well, Willie was eating everything. And his roommate said, "Stop it." And he got this delusional thought in his head that his roommate was trying to kill him by depriving him of the food that he needed. So he didn't think of it rationally. I didn't pay for it. I shouldn't eat it. And one day, Willie found himself behind the door to his apartment with a knife and a meat cleaver. And he said, "I was going to take this guy out." And it was only by accident his girlfriend called. And Willie sounded really agitated. And his girlfriend was a friend of one of my kids. And she said, "You're going to see Dr. Amen." So they show up. I had no clue they were coming. And that's what Willie said. I was a short fuse on a stick of dynamite. And when we scanned him, he had like the hottest cingulate gyrus you'd ever seen. This is another case. This is actually sort of a cool story. Reed came to see me 1991, I think. And he came to see me after he had a suicide attempt, and he was in the hospital. And he was one of the nastiest, most negative people you'd ever meet. I wrote about him in Change Your Brain, Change Your Life. Did not like him at all. I mean, I don't know. I mean, as therapists, you have to be honest with yourself. There's some people you adore, and there's some people you could do without. Well, he was somebody I could do without. He complained about the front office staff. He complained about everything. There was one day I was 10 minutes late because I was dealing with a suicidal patient. And for half the session, he was on me about being 10 minutes late. I don't know if I can. And I looked at him and I said, "Look, I'm the most on-time doctor you'll ever meet." I said, "In fact, in my adult life, I've been to the doctor 10 times. I wait sometimes 2 hours." I said, "You need to let this go." And I could tell my frontal lobes were not working. Because I was really irritated. And that day, I have to get a scan on you. Because in my mind, I was saying, if I don't have all the information, I'm not going to spend 4 years treating you because I don't like you. He called me from the imaging center, crying on the phone. I remember this like it's yesterday. I'm like, my front office staff goes, "Reed's on the phone." And I, "What?" "Oh, Dr. Amen, they did the procedure wrong." "How many SPECT scans have you had?" "None." "How do you know they did the procedure wrong?" It's like, "I'll see you tomorrow." I was so irritated. And then I looked at his brain. It's on fire. But there's two very important things to look at. Let your eyes, on the left image, go down the left side. And what you see is it's hot, but nice and full. If you go down the right side, which is really the left side of his brain, you see the dent? Reed, have you ever had a brain injury? No? You sure? Well, I was 16 and I was mountain biking. And my front tire hit a rock and I fell over the handlebars and I was unconscious. But it wasn't really that long. And if you look at his cingulate gyrus, can you see the cingulate gyrus? Going right down the middle. And look at right at the end, it goes off to the left. That's called an off-center cingulate that happens in brain injuries. Because as you get hit from the side, your brain does this number on itself and will push the cingulate gyrus to one side. And so I looked at that brain and go, I got to fix this, got to calm it down. Now I have empathy. I mean, I don't know if that, I'm like being vulnerable now. Some patients I really haven't liked through the years. And so you lose empathy. But when you look at their brains, you start having more. It's like, I have to fix this. He sees it, and he's much more compliant with treatment. And so I put him on an anticonvulsant to calm down all those hot spots. And then I put him on a Nafranil. Anafranil is an older antidepressant that's approved for obsessive-compulsive disorder. And even though he didn't have OCD, he could never let things go. He actually called himself the anger broker of the Sacramento Valley. All right, 3 months later, after you get the medicine right, no lie, this man is one of the sweetest people I've ever met in my whole life. At which point it causes great confusion for me, because I grew up very Roman Catholic. The world was clear. Good, evil, heaven, hell, you know. They even throw in purgatory just for clarity. And I'm like asking myself, who is he really? Is he this dark, evil, awful man? The reason he tried to kill himself? He was abusing his family, and his wife left him. So you could easily call him bad. You could make a moral judgment on him. Wasn't hard. And I certainly was doing that. I mean, I used more colorful words, but now he's sweet. He's kind. He's loving. He's considerate. He's thoughtful. Rather than only focused on him. How was your day? Who is he really? What's his soul like? I have to tell you, I would argue, you're really who you are when your brain works right. I told this story when I was on the Today Show. January 14th, 1999. And you know, I didn't really think that much about it because I was very nervous when Matt Lauer was interviewing me. 3 weeks later in my office, one of the doctors in the clinic says, Dan, you got to meet this guy. And so I turned around. Here's this guy, 6'8". I'm looking up. I shake his hand. He starts to cry. I said, you know, I have this effect on way too many people. He said, you remember when you were on the Today Show? I said, yeah. He said, I was laying in bed in my home in Las Vegas. And I was figuring out how I was going to kill myself that day because my wife was leaving me. And I really wasn't paying attention, but just by chance, if you believe in chance, the television was on, and I heard you talk about somebody who was like me. And so I thought to myself, you know, I can kill myself tomorrow. Let me go buy this book and see if it's any good. And all of a sudden in my heart I went, oh, you know, they're like people who read this stuff. This like could make a difference, could go either way, you know. So now I'm feeling under great pressure. He said, you know, Dr. Amen, after reading your book, I figured out I had a brain injury playing football. I have ADD. I have depression. And I have a left temporal lobe problem. I said, really? I said, have you seen your scan? No. I said, well, let's look. He had predicted his scan perfectly. And on medicine, he's done really great, hasn't killed himself. But you think of all the people who are laying in their bed contemplating suicide, and they have no clue that a brain injury is part of it, because we don't look. We just assume there's a little bit of arrogance for you to do an evaluation on a client, and you to come up with a case formulation, and you've never looked at their brain. Just a little bit of arrogance in that. I mean, at least now you're going to be able to take a brain science history, and part of the brain science history is you're going to ask them about brain injuries. And you're not going to ask them once, right? You're going to ask them 5 times. And it'll be amazing to you how many people will come back. 5 times they'll tell you no. 3 weeks later they'll come back, I remember. And they'll tell you about all sorts of horrific events that happened in their brain. Another example of a cingulate gyrus problem. You can see how the cingulate goes off to one side. How half the brain is hot and half of it's not. Whenever you see that level of asymmetry, think about cingulate problems, or think about brain trauma. The next part we have to think about is the temporal lobes, because they're very easily damaged because where they sit in the skull. In the skull, they sit in an area called the middle cranial fossa that's surrounded by bone. So imagine your temporal lobe is sitting in this part of the skull, it's surrounded by bone, and you have a whiplash injury. It's slamming up against the front and back part of that bone. And so think of the function of that area: language, long-term memory, mood stability, temper control. Remember, we called it the what pathway in the brain. It tells you what things are, so it helps you identify faces, helps you identify objects. On the non-dominant side, it's involved in rhythm and music and reading faces and social cues and intonation and prosody. It's also involved heavily in spiritual experience. So if it's damaged, you might not recognize that you have a problem. You might have unusual religious experiences. Many people think some of the saints or the early prophets are people that had temporal lobe epilepsy. I mean, you have to ask yourself, is that epilepsy or is that a prophecy? You know, when it doesn't fit with what you think it should be, you know, doesn't fit with the underlying belief, that might very well be epilepsy. So when there are problems, this is a man that came to see me from Normal, Illinois. He had fallen 6 feet head first into a pile of bricks when he was 6 years old. He was arrested for felony domestic violence, hated himself with a passion, hated himself. You can see the dent in his left prefrontal cortex. So the top to your right, see that dent? This is left prefrontal cortex. You're not supposed to have a dent in it. And his left temporal lobe, where the arrow is pointing to. Severe deficit. Explosive. Might have something called intermittent explosive disorder. They may have memory problems, feelings of panic or fear for no particular reason, may see shadows, have periods of spaciness, headaches or tummy aches, be paranoid, feel like people are following them, aggression, and learning problems. Many people we see, they have a whiplash injury and they can't read. Or they have a whiplash injury and now they have problems remembering how to do things in steps. They have a whiplash injury, and if they're an artist, their artwork may turn vicious. We've seen that a couple of times. It's fascinating. You know, they're drawing these beautiful pictures of wonderful landscapes and people, and now all of a sudden the faces are grotesque because it's damaged their ability to see things. This is somebody who never lost consciousness, had a whiplash injury. This is someone you can see damage in their both frontal and temporal lobes, again involved with aggression. Another person, you see damage to the outside of their temporal lobes. And here are occipital lobes. Now, have you heard of coup, contra coup injuries? What does that mean? Coup is where's the site of the injury. Contra coup means because your brain is in a closed space. If you get hit here, think about the pressure. If you get hit here, the other side's going to get hurt too because your brain is going to slam against the front, bounce, and slam against the back. So you can get injuries in the front and the back. Parietal lobes, top back part of your brain. They're involved with tactile stimulation, eye-hand coordination, position sense, determining your left from your right, arithmetic, reading maps, creating maps, admitting when you have a problem on the right side. If there are problems there, you might get lost, or you might be in denial of your illness. You might not care, be indifferent. You have left-right confusion, impaired construction. You might not be able to dress yourself properly, have trouble writing, and so on. Occipital lobe trauma, you might have trouble seeing. Or depth perception could be a problem. You have this thing called blind sight. You can't really read the words, but you can do what the words say. Now, in looking at imaging, one of the things imaging cannot do is it cannot date the trauma. I can look, I go, oh, you had brain trauma, but I can't tell you when. You have to have a clinical history. Unfortunately, besides here where we have it a lot of places in the world, they don't have it available. One of our goals, we have somebody coming to visit us from Croatia. And then we have somebody else coming to visit us from China. It's just sort of cool. You know, this needs to happen all over the world. All right, treating brain trauma at Coastline Community College, they have a brain trauma program. If you have somebody who, you know, they are really looking for a rehab program, Coast Community College, they can actually sign up for it, and it's not very much money. So that would be a resource. You want to educate them about what they have. There's actually a wonderful school in Tustin. It's called the Tustin Center. It used to be called the Alex Center. That was started by parents of a child who had a severe brain injury. And it's a school for kids who had brain trauma. And if you're ever looking to donate money to something cool, the Tustin Center is just an amazingly wonderful organization. So, education. Teach them about what they have. It's critical to coping. So you need a clear diagnosis so you can understand what the problems are. And often in education, you got to get their families in, and their friends, you know, their caregivers. You got to write things down because they don't remember them. If they injured their temporal lobes, they're not going to remember things. Let's see. In the animal self-help section, let's see. Gary Larson on patient education, dare to be nocturnal, do it by instinct. My favorite one is how to avoid natural selection. Support is critical. And there's the Brain Injury Association of America. So they can learn about it. There are internet sites, there's support groups that can be very helpful. Medicine can help. This is a before and after scan on a stimulant called Adderall. So can you see the difference before and after? Now you can see the contra-Q injury. So to the left, frontal lobe injury. To the right, occipital lobe injury. On medicine, things can be better. So that's pretty exciting, I think. Another example where medicine can make things better. We think exercise can make things better. The right kind of supplements can make things better, and the right kinds of psychotherapy can make things better. Another example. This is actually an Egyptian man who had a diving accident, who severely abused his wife, and he was 18 years old, and very much like the rocks off of Corona del Mar here. Anybody go diving off the top of the rocks out there? Well, when I was in college here, we would do that. Not that smart. Not that smart. He had a diving accident and really damaged his brain. And you can see with medicine it was better. Just lots of examples on how the right treatment can help change brain function. So the branch of psychology called, cognitive rehabilitation, where they restructure somebody's environment to make it easier for them, where they overlearn adaptive responses, or they use aids like Palm Pilots. Problem is they lose them, so you don't want to get them expensive Palm Pilots. Reminders, appointment books, and they work behavioral to coach them to sort of like overlearn organization. All right, brain trauma is very common. You can see it with imaging. It can change somebody's whole life and nobody may know about it, which puts them in hell. And nobody knows about it because they think they can just change. If they wanted to, if they willed themselves to, if they prayed hard enough, if they believed hard enough. And that's dangerous. Because if it doesn't work, and it doesn't always work, if it doesn't work, then they hate themselves, and then they hate God. Narcissistic personality disorders often hurt frontal lobes. They have an inability to get outside themselves. The person they see in front of them is them, not other people. So I think it's probably frontal. It's a great question. Chemotherapy is toxic to the brain. I mean, when you have cancer, they give you chemotherapy to kill cancer cells. Well, normal cells get knocked off as well. And often normal brain cells get. Now, there's certain cancer chemotherapy agents that are much more toxic than others, but clearly it looks like you've had a brain insult. And for some people, you know, a year or so later, they're pretty much themselves again. Other people, they're never fully themselves because of the toxicity from the chemotherapy. It's a really good question. Well, think about women who, the question is, if you have too much testosterone on the brain, what might that do? Think about women who are DES babies, women who are androgenized. So they were given diethylstilbestrol to prevent them from being aborted. And there's a higher incidence of cervical cancer in them. But the women that did not have cervical cancer, their math skills were better. Often their language skills were better. And they were more aggressive and more sexually aggressive. So they sort of acted more like guys.